Are you a physical therapist learning English and struggling to find the right words when speaking with patients? Maybe you know exactly what you're doing clinically, but explaining exercises, giving encouragement, or answering patient questions in English feels like a challenge. If so, this lesson is for you. Hi, I'm Jer and welcome to Learning English Pro, the channel where healthcare professionals improve their English communication skills and build confidence in their careers. In today's lesson, we'll cover 50 essential phrases for physical therapists. These phrases will help you explain exercises, guide treatments, and connect with your patients in a clear and professional way. Good communication isn't just helpful, it's essential for patient care. Research shows that clear communication improves treatment success, builds trust, and helps patients recover faster. However, as a physical therapist learning English, you might find it difficult to explain complex instructions or encourage patients with the right vocabulary. Many patients might not speak your first language, and that can make every interaction feel even harder. That's why this lesson focuses on key phrases physical therapists need to know in English. These are simple, practical phrases that you can use every day to feel more confident and effective. To help you even more with this lesson, I've created a downloadable guide for my student members. It includes all 50 phrases from this video, 2 interactive exercises to practice, and a glossary of 20 key physical therapy terms. Use it with the video to build your confidence through repetition and regular practice. If you want to join the student membership on my channel, just click the link in description. There are lots of perks to help you boost your English learning. This lesson was actually inspired by one of my student members, Tatiana, who recently requested a video specifically for physical therapists and rehabilitation specialists. Thank you, Tatiana, for your suggestion. It's always great to create lessons tailored to your needs, and as a student member, your requests get priority. In our first category, we will look at phrases related to initial assessment. Can you tell me where you're feeling pain? This phrase highlights the importance of understanding the patient's specific pain points, helping to focus the assessment and treatment plan. When did the pain start, and has it changed over time? With this question, we're emphasizing the timeline of the issue, which can provide clues about the injury or condition. Have you had any previous injuries or surgeries in this area? This phrase ensures we're gathering the patient's medical history to avoid complications and provide tailored care. Can you describe how the pain feels? Sharp, dull, throbbing, or something else? Here we're encouraging the patient to give detailed descriptions, which can aid in diagnosing the issue more accurately. Does the pain get worse with certain movements or activities? This is a great phrase for identifying triggers and understanding the patient's functional limitations. Let me know if anything I do causes discomfort. With this sentence, we ensure the patient feels comfortable communicating during the assessment. Let's move on to our second category, which is patient education. This exercise targets the muscles that support your spine. Here we educate the patient about the purpose of a specific exercise. Good posture can help reduce your pain over time. This phrase highlights the benefits of maintaining proper posture. Strengthening this area will improve your overall stability. With this sentence, we're explaining the functional benefits of targeted strengthening. Using ice packs can help reduce inflammation after exercises. This phrase provides actionable advice for managing discomfort at home. Regular stretching can prevent stiffness and improve flexibility. This is a great way to emphasize the importance of incorporating stretching into daily routines. Moving right along to our third category, which is treatment instructions. Let's start with some gentle stretches to warm up your muscles. This phrase introduces the session and sets the tone for a gradual and safe start to treatment. I'll guide you through this movement. Try to copy me as closely as you can. Here we're emphasizing clarity and patient engagement by providing a visual and verbal guide. Remember to breathe evenly while doing this exercise. This is a great reminder for patients to stay relaxed and avoid holding their breath during exercises. Let's focus on improving your range of motion in this area. With this phrase, we explain the goal of the exercise, keeping the patient informed and motivated. If you feel any sharp pain, stop immediately and let me know. This phrase highlights the importance of safety and open communication during treatment. Keep your movements slow and controlled to avoid straining the muscles. This sentence emphasizes proper form and minimizes the risk of injury. You might feel some discomfort, but it shouldn't be painful. This phrase sets realistic expectations for the patient during the session. Let's adjust this exercise to make it more comfortable for you. This is a great phrase for personalizing the treatment and showing empathy. Hold this position for 5 seconds, then slowly release. Here we are providing clear and actionable instructions for a specific exercise. We're already on our 4th category and it's a nice one: how to give encouragement and feedback to patients. You're doing great. Keep it up. With this phrase, we're reinforcing the patient's efforts and boosting their confidence. Let's try that movement again, but with a little less force. This is a constructive way to provide feedback and refine the patient's technique. You're making excellent progress. I can see an improvement already. This phrase helps keep the patient motivated and reassures them of their progress. It's okay to take a break if you need to. This phrase emphasizes the importance of pacing and listening to the body. Great job! You've really improved your balance since last time. With this sentence, we're recognizing and celebrating the patient's achievements. There are always challenges with treatment, and in our 5th category, we have some great phrases to deal when issues pop up with patients' treatment. Let's modify this exercise to suit your current range of motion. With this phrase, we show flexibility and adaptability in treatment. If this position is uncomfortable, let's try an alternative approach. This phrase ensures the patient feels supported and understood. It's normal to feel frustrated, but every small step counts. This is a great way to acknowledge the patient's emotions and keep them motivated. We can adjust the intensity based on how you're feeling today. With this sentence, we're prioritizing the patient's well-being and comfort. Recovery takes time, but you're on the right track. This phrase reassures the patient and fosters patience during the process. With our 6th category, we're going back to some more encouraging English with some great motivational phrases. Each session brings you closer to your goals. With this phrase, we're keeping the patient focused on their progress. The effort you're putting in now will pay off in the long run. This is a great way to encourage persistence and long-term thinking. Remember, small improvements add up over time. This phrase motivates the patient to appreciate gradual progress. You're stronger than you think. Let's keep going. With this sentence, we provide a boost of confidence to the patient. You've got this. I'm here to help you every step of the way. This phrase reinforces the therapist-patient partnership and trust. We're almost at the end of our lesson. Our second last category is very important: safety and precautions. Let's make sure your movements are safe and within your limits. This phrase emphasizes the importance of safety during exercises. If you're feeling dizzy or lightheaded, stop immediately and let me know. With this sentence, we ensure the patient knows how to respond to unusual symptoms. Be mindful of your posture when lifting objects at home. This is a great way to provide practical advice for daily activities at home. We'll avoid any movements that could strain your injury further. Here we're showing care and caution in tailoring the treatment plan. Use a support or brace if you feel unstable during activities. This phrase offers a helpful suggestion for maintaining safety and confidence. Can you believe we're on our last category already? These handy phrases will be useful when you're closing the session with the patient. Let's finish with some light stretches to cool down. This phrase helps transition from active exercises to a more relaxed state. How do you feel after today's session? With this question, we're encouraging patient feedback to gauge the session's success. Make sure to drink plenty of water after this session. This phrase emphasizes self-care and helps prevent soreness or fatigue. You've worked hard today. Well done. This phrase acknowledges the patient's effort and ends the session on a positive note. I'll see you at your next appointment. Keep practicing the exercises we went over. This is a great way to reinforce the importance of consistency in the patient's progress. You're making great progress. We'll build on this next time. With this sentence, we set a positive tone for future sessions. Don't hesitate to reach out if you have any questions before your next appointment. This phrase encourages ongoing communication and trust. You should be proud of the effort you put in today. This phrase ends the session on an uplifting note, fostering confidence. Consistency is key. Keep up the good work. With this sentence, we encourage the patient to stay committed to their recovery. Take care, and I'll see you next time. This is a friendly and professional way to close the session. Well done, and thank you for watching this lesson on English for physical therapists. I hope these 50 essential phrases will help you feel more confident in your patient communication and make a real difference in your daily interactions. If you're a student member, don't forget to download the guide that comes with the lesson. It includes everything we covered today, plus 2 exercises to practice the phrases and a glossary of key physical therapy terms. Repetition is key, so I recommend using the guide alongside the video to reinforce your learning. To join my student membership, click the link in the video description. If you enjoyed this lesson or found it helpful, please let me know in the comments. I'd also love to hear about your experience. Have you tried any of these phrases with your patients yet? For more healthcare phrases, check out this masterclass video where I cover 500 phrases for nursing. Thank you for being a part of Learning English Pro, and I'll see you in the next video. Keep practicing and take care.